Good evening, and welcome to Future Choices. My name is Fran Snedeker, and I'm the producer and moderator of this educational series exploring reproductive health issues, filmed at the LMC TV studios in Mamaroneck, New York. Last month on Future Choices, we learned from our guest from the Guttmacher Institute, Rachel Benson Gold, that family planning is more than a pack of pills. It is basic health care for women, preventive health care at its best, and we also learned that protection of our reproductive rights is more important than ever in these financially challenging times. Today, we are bringing that message home to New York State. I'm very pleased to welcome to Future Choices Tracey Brooks, who is the CEO of Family Planning Advocates of New York. Tracey is here to tell us why women's health matters.
Thank you so much for having me tonight on Future Choices. Family Planning Advocates is the statewide organization that represents over 350 of our reproductive health centers across the state of New York. Planned Parenthoods, county, hospital-based, and freestanding reproductive health centers that people receive health care at as a basic fundamental location and primary care center. So why does women's health matter in this time? We're seeing many people across our nation and certainly within our state losing health insurance, losing jobs, being unable to pay for health care they may have received before or may have been uninsured or underinsured prior to this economic downfall. Well, our reproductive health centers provide primary care for women's health. And what is very important is to make sure people are aware of it, know what we're able to do for them, and are able to access affordable, reliable health care. So at our centers across the state, including our Planned Parenthoods, we can help you sign up for health insurances that are provided by New York State. We can provide you with cancer screenings, regular annual checkups and exams, prenatal care, and provide the full range of spectrum and choices for women's reproductive health, from teenage to through the ages for women. And so I wanted to make sure that people are aware of that access and accessibility here in the state.
And Family Planning Advocates is the spokesperson, the agency that speaks for this coalition of providers?
Yes. Family Planning Advocates is the interface with New York State's government to make sure that we have full funding for our reproductive health, to make sure that we have rights protected for women in their health care and health care providers, and also to work with the regulators and make sure that regulatory processes make sense in being able to provide reproductive health and health care. So we are the interface with government, yes.
And you Tracey, have been with Family Planning Advocates as the CEO only since December,
yes.
After an extensive career, a very successful career as an attorney in the private and public sector, both in state and federal matters, and also a run for U.S. Congress.
Yes.
How do you come to be so passionate about reproductive health issues that you have come to Family Planning Advocates?
Well, this has been an issue that's been important to me and my family growing up. We were foster parents for babies who were put up for adoption during the time in which parents had the opportunity, or the time to make decisions and choices about keeping their children or providing them for adoption to families that are waiting to love children. And it was during that time that I identified that I wanted to be a part of making sure that our teenagers had the education they need to keep themselves safe and make decisions that they wanted, that our women who are in need of perinatal care had the ability to access health care and health insurance to be able to have healthy pregnancies, and that women who had the timing and need to make choices, whether or not to take or use birth control and contraception, or whether or not to have families at any given time in their life, had the access. So when I got out of college, I spent my first couple of years out of school both volunteering with community center programs that help teach parenting and basic life skills to pregnant and parenting teenagers. And
this is all in New York?
Yes,
oh,
all
great.
in New
Wow.
York. I'm
okay.
sorry, in Syracuse and in the capital region.
Mm-hmm.
And then I had the opportunity, after the volunteer service that I had done, to work in a community health center and to be a perinatal outreach worker and make sure people had the hard services that they needed.
Mm-hmm.
But I will tell you, it was during that work that I was doing that Newt Gingrich decided to cure teenage pregnancy. And pregnancy has never been an illness in the United States, and it certainly didn't need curing. And at that time, his proposal was devastating to our families and communities and the people that I was working with. That's when I determined that policy was the place for me.
Do you want to amplify a little bit on why that was so devastating?
Sure. Newt Gingrich's proposal was that teenage parents who weren't married would be put in foster care and that their babies would be raised in federally funded orphanages. And so I thought if he could make a policy that would devastate communities like that, that I could certainly make a policy that had a human effect attached to it and understood what was going on. So that's when I looked at policy and law as a way to help our communities gain strength. And so I've had the opportunity to practice in the private sector. I've had the opportunity to work with our state government in the state assembly. I also had the opportunity to work side by side with Senator Clinton here in the state of New York, and then had the opportunity to run and look to be a representative for the state of New York down in our federal government. And when that didn't work out, the opportunity to lead up family planning advocates brought me full circle from the days when I was working hand in hand with our pregnant and parenting teenagers and our low-income families to the day that I could advocate to the state of New York to strengthen our policies, to strengthen our health centers, and to make sure that we had affordable, accessible health care and full range of reproductive care protected in the state of New York. Well, that was certainly a job that I was interested in.
And what is your job this year? What are the legislative priorities for family planning advocates in 2009?
Well, we just wrapped up the budget process because it's very important to ensure that our health centers, the approximate 350 across the state that receive public funding, maintain their funding levels to be able to provide health services. Because most of our health centers are people's primary place of encountering the healthcare system for the first time. And generally people are coming to us who are in an emergency situation, either very sick, looking for contraception, having an STI, a sexually transmitted infection, an unplanned or a planned pregnancy, and not having the insurance to be able to make choices and decisions about what they would like to do about that pregnancy. And all of this, our Planned Parenthoods do a fabulous job of providing and working with our communities on.
And most of the people who come to you, to the Planned Parenthoods and to the other health centers, do seek state and federal subsidy to be able to afford their services?
Not everybody who comes to Planned Parenthood is uninsured or they may be underinsured, but all of our Planned Parenthoods take private insurance as well. So it's the gamut. We have a sliding scale fee that could be from paying nothing to paying the top of our sliding scale. We do help introduce people to New York state insurances that they may qualify for, and as I said, we do accept private insurance.
In his vision for healthcare reform, President Obama emphasizes prevention. How does that tie into the work that that the Planned Parenthoods and the other providers that are members of FPA, Family Planning Advocates, are performing?
Well, the majority of the work that we do at our reproductive health centers and our Planned Parenthoods are preventative work. It is counseling, it's ensuring that people have access to contraception, it's that people are aware of how sexually transmitted diseases are conveyed back and forth. It's keeping people educated on their reproductive choices. It's ensuring that people have access to entry-level and preventative care and reproductive health. So that's a